Howdy, I'm Robin Murphy, and today I want to talk about how robots are helping the world cope with COVID-19. I'll be going over work that's supported in part by the National Science Foundation, and I'd really like to call out my graduate student, Vignesh Ganduti, who's really done the majority of the data analysis, which I hope you will find useful. The big takeaways are, good job. Robots are being used for at least 30 discrete use cases spanning 6 very different socio-technical work domains. So wonderful to see at least 203 ground, aerial, and even though they're not counted in here since when our survey stopped, we found 2 marine robots that have been used for COVID. It's just great. And the data, though, indicates that innovation is less about building novel robots and more about working with users before a disaster. And to get to that conclusion, I want to tell you about how we collected and filtered the data that forms the Robotics for Infectious Disease, R4ID, open source database, how we analyzed the data from a NASA technical maturity perspective, and that we constructed a model of adoption, and then from there we make the conclusion that innovation is less about novelty and more about user-centeredness. Let's start with talking about the collection methodology. We collected data from the press releases, from the popular press, from social media, from scientific journals. That led in between, this was between March and July 4th, with the earliest uses that were in the reports referring back to the first use of a robot, January 24th. And that gave us 286 reports. But some of those were kind of just, oh, robots could be used for COVID, or robots are a threat to our jobs, or robots could revolutionize medicine. And so we filtered those out. We instead had robots that it had to say it was a robot and it had to describe an actual explicit use, not in the laboratory, but you show the robot in an actual end user location. So that left us with 262 reports. Now, some of those reports, as you can imagine, were things that had been retweeted or republished. And in some cases, there were, like in a big demonstration, where lots of different press people wrote about the same robot doing the same thing. So we merged those duplicates into what we call entries, and that left us with 161 entries. But often the papers, the reports, the entries would talk about more than one model of robot. And so we split the specific model of robot in the use case, or if there was a single model of robot but it was used in 3 or 4 different ways, that became a separate instance. So we have these 203 instances of a model of a robot, a unique model of a robot for a unique use case. The result of the actual uses of models of robots were that we found 34 countries had used them. The 203 instances, the majority were unmanned ground vehicles, 119, but notice how many were unmanned aerial systems. And even though it's a bit of an eye chart, you can see that the majority, the largest uses were China and the United States, as you would expect, India, South Korea, Italy, Singapore, Thailand, UK, Spain, the United Arab Emirates, that quite a few, and then there were just reports of one-off. Now, of course, there are limitations of doing a search in English, but a lot of keywords were robot and COVID that shows up in any of the literature, and then we could use the video and go from there. So we did get some more, I think, good international coverage. And 203 is a lot of instances, so I think it gives us a trend. But how do you analyze that data? What does that tell you about adoption? What should we as humanitarians be doing to get these robots into the hands of responders? So one way to think about how robots are used is to think about them for pandemics. And this is a lot of the articles that you're seeing in Science Robotics, including one that I helped co-author, focus on this medical side, the prevention, the detection of the disease, the diagnosis, the treatment of the patient, and then how the patient recovers. And that's great for gaps analysis of specific medical tasks, but that patient-centric focus on clinical hospital care and the medical laboratory automation doesn't quite capture what we were seeing. So we went back and looked at it from the classic socio-technical work domain, from the cognitive work analysis, if you're familiar with industrial engineering approaches from there. And the advantage of doing this, not only is it broader, but also lets us think about disasters in general. And we call it socio-technical because what you're doing is you're trying to cluster the uses, you're trying to define work domains in terms of stakeholders who make the adoption decision, then the interactants, it may be the healthcare worker, the nurse who's operating the robot, and the patient who may be very ill and disoriented. So what are the interactant skills and expectations? What are the regulatory or budget constraints that these stakeholders have for adoption? And that's more the social side, right? But the technical side is, all right, what is the mission? What is the objective of this robot? What is its work environment? Is it indoor, outdoor? Is it cluttered? Is it urban? Is it open? Is it a field? What is it? And what are the particular types of use cases that you see within a work domain? Well, looking at it that way, we identified 6 socio-technical work domains. And I'm going to bring them up to you in the order of frequency of occurrence. So 74, the largest use, 74 instances of the 203 instances were for public safety. And the basic objective was public safety, law enforcement, or perhaps public works people enforcing public health policy, commonly by maintaining social distancing and quarantining regulations, but also spraying disinfectants. The second largest use was clinical care, which is odd, right? Because we think of clinical and medical care as a really big focus of the pandemic. Well, and the goal there was not to do so much the medical care itself, but to protect the healthcare workers by reducing their unnecessary exposure. I mean, the nurses and nurses' assistants were still very much, they wanted to do compassionate care. They go in and you really need to see and talk directly. But the routine stuff, or just trying to screen if somebody's got COVID, protecting them was a big deal. And the hospitals had to be able to handle the surge. And one big surge problem is things like disinfecting the hospital and sanitizing rooms for the turnover and delivering meals and prescriptions, so automating those. The third largest category was a surprise to us, the continuity of work and education, where individual companies and consumers and institutions would worried about protecting their workers or their customers, or they were concerned, as in meatpacking plants, of what do they do with sick workers when they have their workforce is being decimated with illness. And then what about warehouses that now have a huge surge in demand for online orders, and they don't have, again, the number of people. People are sick, they can't hire enough to cover it. The fourth largest was quality of life, enabling routine life during lockdown. Now, some of the routine life is social things like you see, like being able to graduate, have your little graduation ceremony, everybody witness. But delivery robots went from being kind of interesting to that's how we're getting groceries for our neighborhood, which is lockdown. Laboratory and supply automation was interesting because that was the #1 request we got when we started looking into COVID and working with doctors. They said that was the weak link in the medical chain, was being able to handle the surge in demand. And laboratories are not located next to hospitals. They're usually in an industrial part of town. So having drones or delivery vehicles be able to zip this to them or zip reagents to them was really helpful. And also just having robots be able to handle infectious materials is a big deal. And the last care was non-hospital care, which in the United States focused on nursing homes. but in other countries where they had quarantines, like places in hotels, getting food delivery things. So it's trying to enable routine life, you know, the basic necessities for there. All right, so there you go. One thing you can see now, if we're going to superimpose in proportion the UGV and the UAS distribution, the ground vehicles versus the aerial vehicles. So blue is the aerial vehicles, and on top, because blue is sky, and brown on the bottom because that's ground vehicle and the earth is brown. Okay, what you can start seeing immediately is that there's a lot of use of unmanned aerial vehicles, particularly in public safety, and everything in clinical care, hospitals, was ground vehicles, and then kind of was split. Well, it turns out public safety, law enforcement, has access to a lot of inexpensive general purpose drones, and DGI was actually donating drones to law enforcement communities to use them. Hospitals, indoors, cluttered environment, very irregular, so it favors unmanned ground vehicles, and the types of manipulation, carrying, delivery favored that. Now let's break that chart down into the 30 use cases. And again, you've got the brown and blue to indicate where the UAVs versus the UGVs were. Okay, what you're seeing here in the use cases is that a lot of quarantine enforcement, a lot of disinfecting point care, and a lot of healthcare telepresence. Those were the really big use cases that came up over and over again in the reports. Now, if we look at, I know there's an awful lot of data on that chart to look at, but one of the big takeaways for us is that telepresence is not only important, it was important, but it's not a temporary step on the way to full autonomy. In robotics, we often think of teleoperation as a degenerative case of autonomy. You know, we just couldn't make it work. No, it actually, you would never replace the person. You need the person to be interacting with other people. They want to interact with other people. They don't want a robot to come in and talk and try to do certain things autonomously. That kind of defeats the point, particularly for compassionate care, for social interactions and personal interactions. Another thing is, look how cross-cutting some form of delivery or some form of sanitation was. And those are definitely interesting applications that would be well suited for full autonomy. All right, let's recap. 203 instances, 6 work domains, 30 use cases, and we gave a little bit of feedback on some future research topics. Now, let's get back to the main topic. What can we do to improve or accelerate adoption? Certainly not going to be making autonomous or those will depend on the actual use case. But what in general can we do to help with robots? Well, the previous heuristic has been, based on some of my work, looking at 36 disasters in 8 countries, is that what we saw is that the end users were choosing the robots, existing robots, so we call that availability, with established reliability and performance for a similar work envelope and a similar workflow, which we'll call suitability, and minimizes the risk, the overall risk, because you don't want to make a disaster worse. But that's just a heuristic. And the problem has always been, even if you had a lot of data, instead of 2 or 3 robots being used at one disaster in one community, how would you measure suitability and risk? Well, we certainly have a lot of data in a lot of countries now to look at. So how would we measure that suitability and risk? Well, one way is a metric of risk, is sort of maturity of the technology. And the technical readiness levels from NASA is really well known. But it doesn't really capture what risk you incur when you have to do a modification, which you would think of a disaster that you have to do something perhaps a little differently. And it doesn't capture system effects, that the device works, but it has unintended consequences on the workflow, the processes, the workload, the staffing. So you may have actually created more work or more cognitive work inserting a robot, which would be a net loss, even though, the device works perfectly and as stated. So NASA has actually started walking away from the TRL, and they've started using a technique called technical readiness assessment, which focuses on trying not just to get the engineering device maturity, but whether it's suitable and whether it has a potential of risk. And so they divide this into 3 categories. And they have a very complex decision flow chart for classifying technologies. So this is my interpretation. And when we classified, we used their flow chart. But just to give you an impression, you see a heritage system is an existing system. It's mature hardware. It's basically being used for the same task or mission. It fits those existing work processes, and it has a low potential of failures and unintended consequences because it's basically doing the same thing. Okay. Now, when you start modifying it, you tweak it, you refine that system, it's an engineering system. So now you still may have mature hardware, but you've added something to it. The mission may be slightly different, so it may be the same hardware, but you're using it a little different way. And again, with that using it a different way, that may mean different people are using it, the work processes are different. There's some implications there. You may not be able to estimate how well if it's going to change that. And then just because of that, you don't really know what the risks are. It should be well bounded, but you can never be sure because it's not an identical mapping over to this from the way you've used these robots into the new event. And then we have new systems. New systems typically either have very new hardware or software. They're not being used for the same mission, or they are definitely not being used by the same people in the same workflow processes. So they're going to have a high risk. They're really experimental systems. So you've got no evidence that they're a low risk or won't introduce unintended consequences. So that's an interesting way. And now we went back and looked at these robots in there. So what did we find? Every one of the 6 work domains relied on heritage robots. Look at that. They by a large degree, relied on heritage robots. And not only did they rely on heritage robots, they often had choices. We were able to identify 67 models of robots that were commercially available. So a lot of times you had a choice of what robot to use. That would do the same mission that were commercially available. Isn't that interesting? Now, let's look at this in terms of modality. The heritage systems, you can see the UGVs, mostly UGVs, and a lot of unmanned aerial systems, right? But when you looked at engineering, it was almost all unmanned aerial systems that were being tweaked or modified. Very few ground robots were being tweaked or modified. It was usually a mobile base that they strapped a camera or a laptop to. Okay, so perhaps that says that unmanned aerial systems, which tend to be built as platforms of which you're going to pop in a payload, you're going to have plug-and-play payloads, maybe they've been more successful at that than we've seen at UGVs and being able to do that. But now let's look at what happens when we look at the new uses. Building a robot from scratch almost always involved an unmanned ground vehicle. And does that mean that ground robots are less flexible? That if I'm going to use a ground robot, I'm going to just have to start over and I'm going to have to do major modifications to it? Or maybe it's a philosophy that we like to just start over and build things. Anyway, interesting questions, right? Now, what did we learn about barriers to adoption? Now, everyone would say, oh, regulations are the barrier. Turns out they weren't. In clinical care, which you would imagine being related to life, medicine, privacy, it would be the most regulated. The regulations weren't cumbersome because most of the devices being used were not medical devices. So the regulations were much more flexible. And even if they were medical devices, like the nose and mouth swabbing robots, there are experimental waivers. It's possible to get those. It's a well-established process. And so if you can make a good case, then it gets waived. Now, other things like aviation, public health agencies, hospital insurers, they all have mechanisms for emergency exceptions, like accepting telepresence for the insurers. What we did see was that the availability, and perhaps more correctly, the visibility of whether there were existing heritage systems or systems that could be easily engineered was possibly a barrier, as well as economics. So the economics is important because everything in a hospital has to be an allowable charge or clear economic savings to their indirect cost. Insurers, telepresence got accepted because insurers started accepting telepresence. So once they did that, that made that possible. It's also nice to note, interesting to note, that 9 clones, robots that just clearly duplicated existing robots, their motivation for duplicating that was either the robots were too expensive for that community to buy, so they were going to build it from scratch, it was cheaper to build, or that there was a lack of inventory, particularly with disinfecting robots. I mean, you just don't have hundreds of those lying around, they're expensive, and so they couldn't get them. You know, they couldn't afford them and they couldn't get them. Now that raises questions of were intellectual property violated, and even more so, how did they know it worked as well? I mean, that duplication of there can have some questions. But interesting to see availability and economics were notable barriers. Now, we went back and put this together from a very different view, trying to pull this into a single model of adoption. So when a disaster occurs, we see a demand pull, that the responders, the end users, the stakeholders already know the majority of the ways they would like to use robots. So they have these a priori use cases, and in fact, probably some hospitals are already using robots to do this, but not everybody. And some police departments are using robots, but not everybody. So now you have this demand pull, and that demand pull favors heritage robots based on availability, suitability, and risk. But in some cases, for whatever reason, your heritage robots need to be modified. That gives you a smaller instances of engineering. And in some cases, you may come up with a novel hardware or software like the clones to fix the problem. Okay, and that gets you a specific robot for particular use. That's good. That inserts the robot into actual operations. Now, if you have a true novel use case emerge, like mouth swabbing and nose swabbing, which really hadn't been thought of as a big deal to do with a robot and became, it was an extremely hard task and nobody had been looking at it, that really gives you the innovation push instead of the demand pull. And you see that you get these new systems that are either taking existing hardware and software, essentially teleoperated robots, and using them in different ways. Or they're starting off in just rebuilding hardware and software for that application. And these, though, tend to be opportunistic experimentation. Even though they're conducted in a hospital or in the field with users, they're not really, they're onesies and twosies, right? They're never going to have the scale or reach to make a huge difference for the current disaster, but of course, opportunistic experimentation is very important and very desirable. It's how we learn. Now, this gets into barriers to adoption from this model. The first barrier is it's hard for us as roboticists to make a difference if we don't understand the work domain prior to the disasters. I mean, we can go and say, hey, what are your a priori use cases? But they're busy. It would be better if we had already thought about those a priori use cases and could point to heritage systems or systems that we could engineer to fill gaps. The second barrier to adoption is this need for rapid manufacturing. Well, you know, there'll never be enough robots to handle with a global pandemic like we've seen with COVID-19. So how do we rapidly manufacture reliable, well-suited robots? That's a big question in robotics. A third one is, how do we predict suitability and risk, particularly for complex environments? And this is true in disasters all the time. I mean, most of the time it comes down to taking who's ever the roboticist, their word for it. And often our word is not very credible because we don't look like we've ever been in the field and really thought about it. I mean, a lot of times this is, in the cases, you're just having to trust me and my judgment. And we need formal methods. There was some lovely work by one of my former PhD students, Dr. Chu-Soo Chow, on outlining the different types of ways to quantify risk in complex environments. And then the fourth is that you will have to do some innovation, either for engineering or for some novel hardware and software, but also for that innovation. And that means we need much more general purpose robots that can be easily adapted. The ground robots do not appear to be general purpose and easy to adapt. They appear to be single purpose, and not a good plug and play load, not a good user interface, easy to add third-party software to. So what's the takeaways for us as humanitarians? I mean, that's why we're here, right? We want to see this for society's good. Well, a practical guide, I guess the first thing I want you to start off with is that clearly you want to go in and offer to help. So as we've been told by many of the doctors who've been on the receiving end of roboticists volunteering to help, start out by asking what their problems are. And then either work on those problems or get out of the way. Because if those problems don't involve your robot, doesn't matter what your robot does, you're just going to be in the way. So either work on what if they just need an app to do something, schedule everybody's workshop, maybe then work on that if that's in your capability. We've seen 4 syndromes, and I don't mean to be preachy. I'm sure I have fallen into these. And, it's a temptation. I've done this too, but let's not do this. I mean, first off, that pet project. My invention or product would just be perfect. I'm going to get it hook or crook into this disaster because it'd be perfect. And that gets, there's another one, the fear of missing out. Everyone else is doing it, so it must be safe or ethical. There's some real interesting uses of particularly the unmanned aerial vehicles that can be used in certain countries, but in other countries would be citizens' view as violations of their privacy and their cultural expectations. So just because one country's doing it doesn't mean you could or should do it here in another country. The one that I hear a lot is something is better than nothing. I'll just whip up a robot overnight. I mean, they don't have anything, so something's better than nothing. No. You can never make the disaster worse. That's unethical. And you don't want to mislead the responders as to what your robot can do. I mean, look at that issues of suitability and unintended consequences for workflows and workload. And then there's the hidden agenda. There's like, I'm going to use this to get experimental data. Yeah, but you probably want to put that as a second priority, not the primary. There was a disturbing trend at the very beginning in the United States where we saw a lot of groups on Facebook, on private channels saying, we're going to get them to relax these cumbersome rules and regulations, and once they've relaxed them, they'll never be able to unrelax them. So we'll just, they can't say no because it's a disaster. And there was no justification for why they were doing it. They were just taking advantage and kind of bullying the agencies into relaxing some rules. And then another one I hear a lot is, we really want press coverage. Sure, we all want press coverage. But I tell you, the press coverage is the rule is quick and easy. You don't get press coverage. You don't even ask for permission to go through their public information officer or the end user until you have done a home run for them, that you have a success where they're happy with it and you know that they are going to be thrilled to take 15 minutes to meet with the press and say, hey, look how smart our hospital is because we're working with these people because they did this with their robots. If you're not to that stage yet, then don't tweet about how smart you are and how you're doing stuff because you haven't succeeded yet and it just looks like you're press mongering. Okay, and it annoys their public information officer. Another one is just recognizing you just may be too late to help for the current disaster. But if you're too late to help, there may be an opportunity for that experimentation. So you can ask if you can come back later. Hey, I know that when you're winding down, maybe we could bring the robots in and try it. Or, hey, in 2 months from now, could we come back and circle around and see what the lessons learned, and maybe you could give us feedback. So that's some things that you can look at doing. I think the real goal here is to take advantage. I mean, don't let a crisis go to waste. Use this as an opportunity to reach out and make partnerships with end users and to motivate your students and your colleagues and get ready for the next one. Because after all, as we know here at RES site, alone we can do so little, but together we can do so much. And that's really the motto and the purpose of the RES site committee. So, of course, resources, check out our roboticsforinfectiousdiseases.org. You can join in the de facto consortium committee. You can add references, papers, sources, things you've seen, and you can see what the links in the sort of portal that we're doing. And I hope you find this useful. And whatever you do, please continue to put your great thoughts, your great effort, your passion into making the world a better place.